So, how can you assess if the patient is not following your plan? And if so, how can you figure out the reasons why they're not following your plan? So, let's just talk about reasons for non-compliance. The patient misses return appointments. And sometimes you start seeing a pattern of this where they're missing more than one appointment. This is going to be due for a lot of reasons. Some people are so disorganized they don't even get the time right. But otherwise, oftentimes a sign of non-compliance is they just don't make the appointment because they figure out they didn't do what you wanted them to do. They don't want you to be upset with them. And you might want to say, even at the first visit, look, for your follow-up visits, if you haven't gotten done what I want you to get done, either you say, I still want you to have a follow-up visit, or call us and see if it's still appropriate to have that follow-up visit. But please communicate with us about that, because you don't want people just not making appointments because they haven't done what you want them to get done. That's the same thing when they didn't get the lab tests done. Another reason, the patient just stops taking the supplement. And I already told you, because they don't understand the reason for it. They haven't been told how long to take it. Or the patient's not compliant. They haven't changed their diet. You have to ask them, what dietary changes have you made? How is that going? And they'll tell you, this is really difficult. I've been traveling a lot. I've been eating a lot of fast food, whatever. And then I find often patients aren't changing their sleep schedule. Like, I ask them to change their sleep schedule. They're going to bed when they're completely exhausted. They're not setting a bedtime. They're not establishing that. And so you got to troubleshoot that. Or patients aren't doing exercise as you prescribed. Okay, so try not to be defensive in your language if the patient states they're not feeling any better. Really important. Or if the patient says, I'm really upset, I paid so much for that visit and these supplements and these tests. Okay, so this is the way I've been able to handle this. I say, I appreciate you sharing that you do not feel much better. So in part of today's visit, I want to troubleshoot this together with you so as to help your symptoms and conditions. How does that sound? When I say it that way, those exact words, I have not had many arguments from people. They stop blaming, they stop the anger, whatever. So then you might say, once you've figured out some of these issues, you might explain it to them and present this to them in a non-judgmental fashion. I understand that you don't feel much of an increase in energy. I understand you don't feel a decrease in bloating. I understand you don't feel a decrease in pain. So that's called mirroring. Mirroring is when you repeat and say what you understand they're saying. And you might say, did I get that correct? People actually like it and feel better when they even feel like you actually understand what they're saying. Even if they're saying they're not much better. Okay? And then you say, okay, this is what I think is going on. These are some missing links. This is what I think is going on, and this is what I think we should do. How do you feel about that? Again, when the patient says, I'm the same, there are many factors that can influence whether your patient will even follow your plans. We've gone into a lot of these. But a patient who's not compliant, you need to do an assessment of why they're not following your plan or parts of your plan. Because they may be compliant with certain things, not with other things. You need to troubleshoot it. So some of the reasons, your plan was not well communicated to them. And some of this involves educating your assistant better. I'm at fault for this too. I need to educate my assistant a lot better on some of this stuff. We really need our patients to spend more time with our medical assistant or whoever is going to communicate some of this. How do you do this? And educate them better about what you want them to do, what the supplements are for, etc. Or now you got a patient that's just disorganized. They can't break down your plan into parts, and they really need to break down your plan into parts that they can do. So they might need help with scheduling. Or the patient has habits that are getting in their way of implementing part of your plan. I'm going to have a whole slideshow later on in this course about habits. I've become very interested in health habits, unhealthy health habits, dysfunctional health habits, and how to create new habits. It's really quite interesting. Okay, why else are they the same? The patient's very low in hope. We're going to talk about this, but patients that have very little hope about getting better, it is going to influence their ability to respond and get better. Or the patient has a dysfunctional attitude or belief, and that's actually affecting their ability to take action or to improve. But we're going to talk about dysfunctional attitudes and how to figure out what they are and how to reprogram them. Another thing that's very interesting is the patient is identifying poor health outcomes with you, with this set of symptoms or this condition. That's called linkages. I'm going to talk about this because then the patient is predicting poor health outcomes under your care. So we're going to talk about how to identify that, which is negative forecasting. It's also what's called linkages. And another reason for the same is the patient has applied dysfunctional labels to a body part or tissue. And we'll talk about these labels because if they keep doing it, I always tell people, look, it's hard to get a bad knee better. It's easier to get a right knee better. And I'm going to explain all about this business about labels. Okay. Another reason, the patient is using cognitive distortions like negative forecasting. I'm going to go into these cognitive distortions, how to identify them, a little bit about what to do about them. Or another thing is the patient isn't even in a state of change in which they are ready to do something positive. And we'll be talking about states of change, how to get them into the right state of change. Or the patient's overwhelmed. And that feeling of overwhelm is very difficult for a lot of people, as overwhelm is usually associated with confusion. And we already talked about the patient who's not organized, they can't schedule things, they can't figure out how to implement a treatment or to do a new health behavior. So sometimes you have to help them say, look, why don't we do a baby step? Let's just try X, get you established with this intervention, and then we'll take another baby step. But I find with some of these people where you're thinking about 4 or 5 things, oh, we're going to do heavy metal challenge test and look at that. We're going to check for mold biotoxins. We're going to check for Lyme and co-infections. Sometimes it's so overwhelming. You have to establish it. You're not going to measure and check everything all at once. Say, okay, look, we're going to tackle this initially. Then once we get this area established, we'll go look into something else. Now, it is important to ask questions to find out if they are compliant. So you might say something like, have you been taking all the supplements that I recommended 6 weeks ago? Can you actually tell me which ones you're taking? If they can't tell you what they're taking, that's not good. So it's actually important to say, on your follow-up visit, I'd like you to bring all the supplement bottles. And then you can ask them that question. They bring out the supplement bottle. Yes, I'm taking it. No, I'm not. So here's an interesting example. No, I'm not taking all of them. I stopped the lithium that you told me to take because someone said it was used for bipolar disorder, and I don't have bipolar disorder. I can't tell you how many times I used to hear that. So the problem with that is they had a misperception about what it was for or what it's usually used for. And you think they have bipolar disorder and that you missed that. And they don't have it, so they stopped it. So in order to deal with this, you have to say something like, look, I want to explain that I don't think that you have bipolar disorder. And actually, when I introduce that I want them to take low-dose lithium, say at the first visit, or maybe at the second visit, because it may not be till the second visit that I deal with brain dysfunction stuff, I'll say, look, I want you to know lithium is used in high doses as a drug for bipolar, but I don't think you have bipolar. Did you know that in low doses, like 10 to 20 milligrams, it has a lot of protective effects on the central nervous system in the brain? And therefore, I want you to take that small dose, and that's what I'm having you do. That sort of precludes them getting freaked out about bipolar and them not doing it. And it's often important to educate who's ever there too. So you're often educating the patient and somebody else, spouse or somebody else. Sometimes I'll go into even more details, like, did you know that lithium is a mineral? It's not a drug. It's used as a drug though. And the reason I'm using low-dose lithium, there's numerous studies that show it's very protective for the brain and nervous system. In fact, some of the things it does is reduce nerve cell death. It reduces microglial activation. It decreases cyclooxygenase. And it may even have an effect on amyloid beta, which can be related to cognitive decline. So therefore, you really explain a lot of the benefits. They may not understand all that, but they're still going to get that in a copy of their note. And then again, you want to emphasize how long you want them to do something. I want you to take the lithium for at least 3 months. See, a lot of people, when they're trying to figure out how long should I take this, they are assuming that they're going to take this until they're feeling better or something, and then they stop. Or they assume, okay, I only have to take it a day or two. If it's not doing anything, I'm going to stop. They get that assumption from how long it takes ibuprofen to start working or something else. But you want to say, hey, what are we going to monitor while you're on these supplements? I'm going to monitor, and you're going to monitor brain fog, your mental energy, and we're going to reevaluate you with the brain region questionnaire. I already told you that when I tell people to take glucosamine sulfate, we're telling them to take it for 8 weeks because the studies showed that's about how long it took for them to notice improvement in knee pain. But like I said, I often notice it sooner than that. So what else might they tell you, and what else might you have to do in regard to the supplement thing? I stopped taking the plasmalogens because it was too expensive. Or I stopped taking the plasmalogen because I was taking too many capsules and decided to stop everything because I was tired of taking so many capsules. The correct answer might be, how many capsules are you taking? And to ask them, how many is too many? You'd be surprised. For some people, 7 is too many. For some people, 4 is too many. And some people, 16 is too many. So you do have to know that. And also, you have to say, okay, look, I understand that this product is very pricey. Would you be willing to take it for 2 months? So sometimes you can get people to take more expensive stuff if you delineate that there's a time period that you want them to take it. And then they say, yeah, I can handle that financially. Okay. Then you might say, based on this list of 5 of them or 7 of them, this is my top 5 or my top 3, whatever it is. Another issue may be that the patient is doctor or clinician hopping, meaning they're going from one to another. They're doing too many treatments and they're not giving any treatment enough time to work. So if you ask them, and it's a very appropriate question to ask, I want to know what other healthcare providers you're seeing and what treatments you're doing. Most healthcare providers do not ask this question. Of course, they want to know if they're going to a specialist, but what if they're going to another functional medicine provider and then they're going to this acupuncture, whatever it is. And it could be even that some things they're doing are affecting your treatment program, so it may not work as well. So then I would ask them, can you write down on your calendar that I gave you your schedule of treatments that you're doing so I can see what you're doing? I've had a number of patients, they were doing, okay, I'm doing chiropractic and physical therapy and acupuncture, and it turns out that they are reacting adversely to somebody else's treatment, but not my treatment. So then sometimes it's important to say, okay, let's put a grade on these treatments that you're doing to determine which ones are really helpful. Is it an A minus, A plus? So then you can help establish, okay, this makes sense to continue doing these treatments. It might make sense to hold up. Like I always say to people, look, if you've done 20 treatments of something and you haven't noticed an effect, maybe you don't need to continue doing that, because the reason they're not doing your treatments is because every day they're going for treatment for something and it's very expensive, but they're not noticing much effect. So sometimes it is important to look at that with them and make some decisions with them. Okay, why don't you hold off on this for 3 or 4 weeks, whatever it might be. And let's just try these treatments and see if you can get their agreement on that. Okay, we're going to shift gears a little bit now and cover the stages of change.
Thanks for listening to Solving the Puzzle with Dr. Datis Karazian. Start your 7-day free trial at KarazianInstitute.com if you're a licensed healthcare practitioner ready to evolve your functional medicine practice. Explore over 300 hours of clinical training, masterclasses with leading functional medicine clinicians, and certification pathways. Or check out the Academy of Functional Nutrition and Lifestyle Medicine at afnlm.com. Whether you're on the path to certification as a functional nutritionist or simply want to optimize your own and your family's health, our skill-building approach builds real-world competence from the ground up. And lastly, if you're dealing with chronic health challenges, visit drknews.com for self-paced courses that help you understand and address fatigue, brain fog, autoimmune conditions, gut problems, and more using evidence-based approaches. The content on this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making any changes to your health regimen. Thanks for listening, and don't forget to subscribe and share with someone who might benefit.